Good afternoon. My name is Tiffany Ruizo, and my research presentation is over the Epstein-Barr virus. So, an introduction of the Epstein-Barr virus, or EBV for short. It is the human herpes virus number 4. It was discovered by Michael Anthony Epstein and Yvonne Barr in 1964. It is commonly associated with infectious mononucleosis and Burkitt's lymphoma and other diseases. Epstein-Barr virus was described as glandular fever in 1889 by Dr. Emil Pfeiffer. Like other herpes viruses, once it is in your system, it will remain so for the rest of one's life. It is naturally found in saliva, potentially transferred during breastfeeding, and accidentally given during a blood transfusion. The Epstein-Barr virus affects B lymphocytes. B lymphocytes are cells that produce antibodies. And so when the EBV affects those lymphocytes, it convinces them to produce EBV virins, which leads to infections in other lymphocytes and lymphoblastoid cell lines. The majority of the virus's life is in its latency stage, which means its inactive stage. However, it can give occasionally the virus through saliva or other bodily functions. With children, the Epstein-Barr virus can lead to brain inflammation or encephalitis, meningitis, or other diseases. The symptoms are asymptomatic, so once a child or an adult has the Epstein-Barr virus, you typically will not see any kind of symptoms until an infection occurs. 15 to 20% of young adults will shed the virus, and 95% of the average adults will have the Epstein-Barr virus. This percentage is really high, so it gives you a really good outlook on the amount of people in the world that do have this virus in their system. So where does it initially start? We know that the Epstein-Barr virus can be found in the parotid glands, nervous tissue, and nasopharynx. Unfortunately, scientists do not know the cell types and the locations where the Epstein-Barr virus is replicated during its first infection at an organism level. So hopefully one day we will know where the Epstein-Barr virus is at an organism level to help properly treat it. The ties between infectious mononucleosis and the Epstein-Barr virus was an accidental discovery. A lab technician working with the Epstein-Barr virus and Burkitt's lymphoma went away for vacation. Upon her return, they discovered in her serum that she had an increase in Epstein-Barr virus antibodies. So this was the first indication that there was a connection between this virus and infectious mononucleosis. So a diagnosis of infectious mononucleosis can be done through blood tests, a look at a patient's medical history, and a physical examination of the listed symptoms. So these symptoms can include fatigue, fever, a sore throat. You could have nausea, sweating, a splenomegaly, which is an abnormal growth in the spleen, and a growth in the cervical lymph nodes. Usually when an individual has infectious mononucleosis, it will occur when one is between 15 years old and 30 years old. Now, children can have infectious mononucleosis as well, and if they do, they will also have, or they can also have puffy eyelids, a decreased appetite, oversensitivity to light, anemia, and headache and chills. So, infectious mononucleosis treatment. It will typically clear in 1 to 3 weeks. However, if you have fatigue, it could clear up even longer than that, so maybe an additional 2 weeks or so. Since it is a virus, antibacterial medication will not be needed. If a child does have an inflamed tonsils, it could interfere with the breathing, so a corticosteroid would be prescribed. Acetaminophen could also be taken to combat any pain or fever, and with fatigue, it's just really plenty of bed rest, and gargling warm salt water for a sore throat. If somebody has infectious mononucleosis, you want to avoid any kind of contact sports. The reason being is if you are hit in your spleen during a sport, it could rupture, and that rupture can lead to internal bleeding, and if it is not treated quickly, it could possibly lead to death. So we really want to just avoid any kind of contact sports just so we aren't put in that potential risk of hurting ourselves. Epstein-Barr vaccines. They are currently being tested. However, there is not a safe vaccine available for the public. If there was a vaccine available in developed countries, children between 11 and 12 years old would receive this vaccine. Now, the Epstein-Barr virus is higher at a younger age in developing countries, and therefore those countries would need to give the vaccines at a younger age. This would be beneficial since even though the Epstein-Barr virus is in its latency stage for the majority of its life, there are flare-ups, so having a vaccine would help whenever those symptoms arise from an infection. So the Epstein-Barr virus and other diseases. In developed countries, 15% of individuals have the Epstein-Barr virus and Burkitt's lymphoma. However, in developing countries, there is an 85% in Africa that have the Epstein-Barr virus with Burkitt's lymphoma. In another disease, Hodgkin's lymphoma, which is another lymphatic cancer, 40% have the Epstein-Barr virus with Hodgkin's lymphoma in America, whereas 80% have the Epstein-Barr virus with Hodgkin's disease in developing countries. Nasopharyngeal carcinoma, or NPC for short, is also known as the Guangdong tumor in China. The majority of the tumors are cancerous. There is a small amount of benign tumors, and those are usually adenomas or papillomas. There are some non-epithelial tumors that can be found, and the Epstein-Barr virus markers are found in the tumor cells. No matter where in the world an individual has NPC, it will be similar in the same demeanor, and there are usually high amounts of the Epstein-Barr virus antibodies in a person with NPC. Prevention of the Epstein-Barr virus. It can be difficult because, as mentioned earlier, once a person has it in their system, they will continue to spread the virus. And once an infection of EBV turns into infectious mononucleosis, one should avoid sharing beverages, avoid sharing any eating utensils, and should avoid any sexual contact such as kissing because it can be found in saliva, and with kissing, saliva is exchanged. So in conclusion, the Epstein-Barr virus is found in a majority of individuals around the world. This can lead to future infections and diseases. Unfortunately, there is no vaccine available against the virus, and if there were, we would expect a decrease in the individuals that have the Epstein-Barr virus, therefore leading to a decrease in individuals that have Epstein-Barr virus-associated Burkitt's lymphoma, Hodgkin's disease, and nasopharyngeal carcinoma. This virus is quite complicated since the location of the viral organism is unknown to this day, and individuals would continually shed once infected. So thank you for listening to my presentation over the Epstein-Barr virus. Have a good day.